Hi, sir. How are you today?
I'm doing good. How are you?
Good. So I'm Dr. Bloxham, and tell me what you came in for today.
Well, the reason I came into the emergency room, I'm not feeling terrible, but I've noticed for about the past week, I'm constantly thirsty. No matter how much I drink, I continue to stay thirsty, and I have like abnormally frequent urination. I would say every 20 to 30 minutes, I find myself in the bathroom. And so I just wanted to come in and get checked out. I didn't think there was anything that urgent. I don't think there's anything super wrong with me, but I just wanted to see a doctor today because of those reasons.
Okay. So when you came in a little bit earlier, we took your blood glucose levels, and your glucose levels were up to 350. Now, 350 is dangerously high. Like, you can die high. Normal glucose levels are around 110. And so, based on your blood work and based on the symptoms that you've been telling me, you do have type 2 diabetes, or type 2 diabetes, or type 2 diabetes.
I have type 2 diabetes.
Yes, sir, type 2 diabetes.
And you're sure?
Yes, positive.
Okay. So, is it deadly, or am I able to manage it?
If it's
I've
something
never
that
even heard of type 2 diabetes. I've heard of type 1.
Well, with type 1 diabetes, your body, like, it just doesn't produce insulin.
Okay.
And so you've got to have insulin shots and things like that to take care of that, since your body doesn't do it itself. It's not something that's type 2 diabetes isn't something that's going to kill you, as long as we take care of it and manage it correctly.
Gotcha. So, like, say that I didn't go along with like treatment methods and I didn't take my medications as it was prescribed. Like, is there anything severe that could happen to me if I didn't follow your recommendations?
Well, Zach, we have this nifty pamphlet for you that you can look through.
Okay.
And that goes over some of the complications that you can have with type 2 diabetes. And so those complications involve things like heart disease, kidney problems, erectile dysfunction, blindness, and all those complications can be prevented and avoided as long as you take care of your type 2 diabetes the way that you're supposed to, and as long as you follow the insulin requirements and dietary plans that we have for you.
Okay, so as long as I take care of myself and make some lifestyle changes, then this is a manageable disease, is what you're saying?
Yes, sir, you shouldn't have any problems.
Alright, so what can I expect for the rest of my hospital stay?
So here in a little bit, we'll have a couple nurses come in and they'll explain to you things like your diet and nutrition kind of thing, rules to follow, and things that you need to do from here on out to make sure that those complications aren't occurring. And we'll also have a nurse come in here and explain to you a little bit more about some more specific complications that can happen, especially like regarding your feet.
Okay.
They're just some very common complications that a lot of people don't pay enough attention to, and it can get you in some serious trouble.
Okay. Alright, well, thank you so much.
Alright, thank you. You have a good day.
You too.
Hey Zach, how are you doing today? I'll be
good.
one of your nurses going over your diet.
Okay.
So I heard you were recently diagnosed with type 2 diabetes.
That is the unfortunate news, yes sir.
I'm sorry to hear that, but I got some things on this pamphlet for you that we're going to go over about on kind of how to go about your diet and exercise activity levels and just ways to kind of deal with like type 2 diabetes now.
Okay.
So it's really important to eat a balanced diet, so proteins, your veggies, non-starchy carbohydrates, and just you want to watch the sugar in the fried foods. I know it's kind of a
So no more Kentucky Fried Chicken?
no more Kentucky Fried Chicken. So we're going to try for 3 meals a day. You can kind of space them out 4 to 6 hours apart, and you kind of want to go with like your poultry, your fish, broccoli, any type of like green vegetable. You want to watch like the potatoes, your breads. You can have some oils like olive oil too. You just want to keep that kind of moderate.
Okay.
Let's see, and you don't want to really use sugar, so we're going to go with Splenda instead, like as needed, but you still want to be careful with that.
Okay.
Let's see what else we got here for you. MyPlate.gov, that would be a good thing for you to kind of go visit and kind of just learn on what to eat, how much to eat. They offer the plate rule, So
Okay.
most of it will be like your low carb vegetables. Then you'll have a little bit more meat, and then you can kind of add your potatoes and things on the side.
Okay.
And then with exercise, that'll kind of help with your insulin and everything like that. Kind of keep it down. Cholesterol will stay down, stress will stay down, and I'll kind of just, these are kind of guidelines where you just help with your type 2 diabetes diagnosis.
Okay.
Do you have any questions? I know it's kind of a lot to take in at one moment, but
Right. So far, what I got from what you just said, that I need to really watch what I eat.
yes.
Stay away from especially fried foods.
Yeah, no
and
more like McDonald's or
high
fast
carbs.
foods. Yeah, you want to stay away from the high carb stuff.
Okay.
You can have it in moderation, but just know it's kind of negatively affect you.
Okay. And you said exercise is beneficial as well?
Exercise will help you out a lot.
Okay.
You don't need to go try to be the next Arnold Schwarzenegger or anything like that, but just trying to stay active and everything like that. Maybe going on a walk or hiking or
Okay.
things like that.
Okay, I think I can handle that.
Oh, that sounds perfect.
All right.
It was nice meeting you. You have a nice
to
day.
meet you too. Thank you.
Hello, I'm going to be a nurse for right now. My name is Esmeralda, and I'll talk to you about foot care. Do you have any questions before I start?
Well, I really don't know a lot about type 2 diabetes. I was just diagnosed with it. And the doctor earlier said that someone would be coming in to talk to me about my feet. He said that there's some common complications. So I just want to make sure that I'm well versed in what to check for and so I can be proactive in anything that's going on with my feet, because I've heard of diabetic patients having their feet or even like their legs amputated due to
Yes.
complications. I just want to make sure that I know how to take care of myself.
Well, first thing you need to know is that can happen to you if you don't take care of your diabetes. Like if you
Okay.
don't check your blood sugar, if you're just eating badly, if you just don't care, that will happen to you. Now, one of the main things that you need to understand is controlling your diabetes is important, especially for your nerves in your legs, in your feet, and in your arms. Because if you don't, you can damage your nerves in your feet, which could cause you not to feel heat, anything cold, or pain, which you call sensory diabetic neuropathy. That's what it's called.
Okay.
Alright? And if you don't, sometimes if you can't feel anything because it's numb, you'll put too much pressure on your foot and you can cause an ulcer that way.
So I would be overcompensating on one side, which
Yes.
will cause like a pressure ulcer.
Yes, because sometimes you won't be able to feel your foot, you'll have too much pressure on it, cause an ulcer, and it depends maybe on your foot or even on a toe, that you would have to get it amputated because of that.
Okay.
Another thing is peripheral vascular disease. You could develop that, like in your arms, meaning it's bad flow, like bad blood flow in your arms, which would cause that. And because of that, if you develop that, if you get a wound, like a cut, it will cause it longer for it to heal.
Okay.
So,
That would explain why a while back I actually had a cut on my leg, and it took way longer to heal than what like I was used to. Like when I was a kid, I would get a cut and it'd heal in like 2 or 3 days.
yeah, it's because of the diabetes. You could
Okay.
get peripheral vascular disease because of that, meaning, like I just said, the blood flow
Okay.
is poor, which results in what you just said.
Okay.
Okay. Another thing, make sure you check your feet for sores, blisters, anything like that. Anything that you have seen that it wasn't there before, you need to go to your doctor.
Okay.
Okay?
So if I notice anything that hasn't healed, like would you say like 2 to 3 days maybe?
Yeah,
To go ahead and call my doctor and get that checked out.
Yes. I wouldn't let it wait off too long because if you do, it could be a problem. You could actually have to have something amputated.
Okay.
I know that sounds scary, but
Yeah.
yeah. And also, you should go to a podiatrist every now and then, like every 2 to 3 months.
Okay.
Just to check up on your feet and your legs, like your nerves.
Okay.
Even if you don't have any problems, which would help. Is that good? Or any more questions?
I think that covers everything. I got a pamphlet from the doctor that kind of gives me some symptoms to look out for if my blood sugar is too high or too low. I know what to eat, and I got a website to check for further information. And at this point, you've told me just about everything that I need to know about my feet. So I'll just kind of follow up with my podiatrist and make sure that I'm taking care of myself.
Nice to meet you.
Today, we gave you some insulin to help bring down your glucose levels like as quick as we could. But what we're going to do with your medication is we're going to prescribe you metformin.
Okay.
And
And
so, what that is it's a hypoglycemic agent, right? And so, all it's going to do is it's going to help bring your blood glucose levels down to a normal range.
okay. And would I have to take? I know a lot of diabetics have to take shots. Would I have to take shots?
Not with this one.
Okay.
So with this one, we're just going to want you to take it once before you eat breakfast, and then once before you go to bed, and
Okay.
that'll help regulate your blood glucose levels throughout the entire day.
Okay. All right. Awesome.
Any more questions for me, or?
No, I'll go pick up that prescription on my way out.
All right, man. Thank you.
All right. Thank you.
You have a good day.